Okay, still good morning. I'm Susan Schneider. I'm president of the Oncology Nursing Society, and I am also faculty at the Duke School of Nursing teaching oncology courses for advanced practice nurses and have done symptom management and adherence research. So I'm going to talk a little bit about the critical role oncology nurses play in survivorship care. And as we've heard throughout the days and the programs, is nurses are often the glue that holds the whole programs together. And we have some upcoming issues with nursing that I'd like to highlight. And one of them is the education of nurses and our inadequate number of nurses that we have that are prepared to provide survivorship care. The other one is nurses are not necessarily functioning to their full scope of practice, and that can help us in providing services to our patients. And finally, I'm going to touch a little bit on the importance of symptom management research and symptom management care, which are critically important to the role of the nurse. So we know there's an increasing need for the number of nurses, both staff nurses as well as advanced practice nurses, in the ability to provide survivorship care. And this is all set in a background where 50% of nurses are over the age of 50 right now. We have schools of nursing that are not necessarily able to provide survivorship curricula in their courses. As I teach in a school of nursing, undergraduate programs are jam-packed with a lot of necessary content and essentials, and trying to put in one or two more things can be very difficult, so we have to be creative in looking at models for how to add survivorship care into our education. We also need to look at how we prepare our advanced practice nurses. Our advanced practice nurses are often prepared as generalists in primary care or geriatric care. They're not necessarily provided care related specifically even to oncology, let alone survivorship care. So how do we do extra education for our advanced practice nurses, perhaps things like postmaster certificates or specialty education in survivorship care are things that we need to look at. There's a lot of things that are going on with the availability of nurses, and all this is occurring when we're not necessarily even able and have the systems to train more nurses right now. Right now, we know that there's a national shortage of nursing faculty. Last year, in 2016, schools of nursing across the country turned away over 64,000 qualified applicants for nurses. So we were not able to even get those nurses into the pool because we don't have clinical sites for preceptors. We don't have enough clinical faculty. And all of this is occurring when traditional support for nursing education is eroding. We know that the Title VIII, which is administered by HRSA, provides nursing education grants, nursing workforce diversity grants, things like the Nurse Corps loan repayment and scholarship programs and the Nurse Faculty Loan Program. Funding for that is eroding right now. There is a 7% or an 8% cut from 2017 according to the House budget, and it's sitting in the Senate, so we're not necessarily even getting the funding we're going to need to keep our nursing education at the same level it is. So that's a critical thing. We need to advocate for more Title VIII funding. We need to advocate for programs, as I said, that support our advanced practice nurses, our nurse practitioners. How can we get them involved in survivorship care? I talked to someone yesterday that says, I need that information and education related to survivorship care. I'm not getting it in my basic nurse practitioner program. They were asking us at the Oncology Nursing Society what resources we had and how we can help with them. So those are things we need to do. We need to look at creative models such as internet-based modules that can be embedded into courses that use survivorship as an example of how we can help patients, and so we need to be more creative about those things. The scope of practice is another particular issue that I'd like to talk about. We know that care provided to survivors by APNs is associated with improved patient satisfaction, cost effectiveness, and patient compliance, fewer hospital admissions, decreased lengths of stay, fewer emergency visits, and decreased healthcare costs. And we had an excellent example this morning provided to us, and it was Regina did that, thank you, about the role of advanced practice nurses in survivorship care. And nurses need to practice to the full extent of their authority. And for one of the things that we need to advocate for is full choice of health providers, so including APRNs. And if a patient would like to go see an advanced practice nurse in their state, and that's who they would like to see for their survivorship care, we need to make sure that the reimbursement models support that and that the language in our state laws support that. There's times when the language in our state laws uses the term physician and not provider, and that it limits our ability to provide care to individuals and decreases our workforce availability. So if we can have more advanced practice nurses providing these survivorship care programs, survivorship care clinics, it can be beneficial. I can give you one example from my state of North Carolina. We have a bill in front of our house right now is changing the language that nurse practitioners can sign for handicap parking permits, because right now it says physicians. Now, all of us can see how those kind of things are examples of watching our regulative language and making sure that nurse practitioners and nurses can practice to their full scope for their training, and we're not having barriers provided. The last thing I'd like to highlight a little bit is cancer survivorship research. And we had quite a bit of momentum with the Moonshot Initiative and recommendations related to symptom management in cancer survivorship. And Deb Mayer was on the panel that recommended that. And we know that symptom management is key to survivorship care. And I'll go as far to say that if it wasn't for managing symptoms, we wouldn't need survivorship care. So if we had all of our symptoms managed from treatment and our side effects of treatments and side effects of cancer, if all those symptoms were managed, we wouldn't need survivorship care. So more research and funding for symptom management, looking at how we deliver symptom management, making sure that it's monitored with our patients. Is there a systematic way that patients can monitor their symptoms, report them more on a real-time basis, perhaps electronically? We've seen some systems that have been developed through research that have shown effectiveness, that patients who had their symptoms managed had better adherence to their treatments, they had better quality of life, they were able to continue on with the things that they wanted to do in their life, and their symptoms didn't get in their way. Whether they're at the start of their treatment and they're having symptoms, if we can manage those symptoms, they're able to adhere to their medications and their infusions and so forth. And later on, if we can help them manage their symptoms, then they can go on and get on with the rest of their life. So research and advocating for research in cancer symptoms, and encouraging our nurses to participate in that research, which many of them do, I think is critical.
Thank you. Larry?